Hello, in this video we are going to discuss Rafi point 201, 11th edition. This point is related to endocrinology pathology. The hormone is parathyroid hormone and the diseases discussed are hyperparathyroidism and hypoparathyroidism. So let's get started. The important mnemonic to remember the parathyroid hormone, that is PTH, is phosphate trashing hormone. So parathyroid hormone is going to cause decreased level of phosphate and increased level of serum calcium. For theory of parathyroid gland, you can refer to another videos, but important thing is to remember that parathyroid hormone act directly on kidneys and the bone, and they act indirectly on the GIT tract. So if there is an MCQ, that the indirect effect of parathyroid hormone is the intestinal calcium absorption, that is via the vitamin D. So vitamin D and parathyroid hormone, they act together to increase the serum calcium level, whereas calcitonin is another hormone that decreases the serum calcium and its functions are opposite of that of the parathyroid hormone. A few MCQs related to hyperparathyroidism. Primary hyperparathyroidism is most common in postmenopausal women. So there is another MCQ. A woman of 45-year age presented with fracture of the neck of femur. Serum calcium is 12.1. What is the most likely cause? So there is a hint of fractures, and there is a woman. The age of the woman is 45 years, and the serum calcium is 12.1, which is increased. So the answer is hyperparathyroidism. Another MCQ, that is hyperparathyroidism will lead to decreased phosphate and it will lead to increased serum calcium. Also a clinical scenario in an MCQ, a 65-year-old woman with a routine blood test which show raised serum calcium, and then there is the discussion of the MCQs that a patient is constipated with abdominal pain, lethargic and low mood, and on biochemical result the serum level is 2.95 millimoles per liter and parathyroid hormone is 24 picomoles per liter. So what is the diagnosis? So the diagnosis is primary hyperparathyroidism, since there is a raised serum calcium and the other symptoms are related to hyperparathyroidism. Another important thing related to the anatomy of the parathyroid gland is that the supply of blood to parathyroid hormone is from the superior and the inferior thyroid arteries both. Metastatic calcification in kidney is also caused by hyperparathyroidism, and there is another MCQ, a chronic renal failure patient on dialysis. Most probable autopsy finding will be hypertrophic parathyroid hormone gland. Then there is an anatomy-based MCQ. What is the location of the superior parathyroid gland in relation to inferior thyroid artery and recurrent laryngeal nerve? So the gland basically lie posterior to the nerve and cranial to the inferior thyroid artery. All about parathyroid and hyperparathyroidism. In the next video, we are going to discuss hypoparathyroidism and vitamin D, which are discussed under the same point, which is 201 point of Rafi. Thank you for listening.